I'm Mark Dooman of the Patient Information Forum. The following videos that you're going to see are from attendees at the Patient Information Forum annual conference. We're very grateful for everyone that attended to make it such a special day, and especially to those people who you're about to see who shared their views.
I think one of the main challenges facing people regarding information is getting the information to people at the time when they need it.
I think the key challenges are making the information relevant, making sure that it's clear, making sure that it's accurate.
There's a plethora of information out there. Consumers find it very difficult to discriminate between good and bad information. Somehow we need to deal with that. The information standard, information prescriptions are part of the answer there in England, but that's a big issue for us, the quality and the diversity. There's a huge benefit there, but there's a huge problem in terms of understanding what's good.
The biggest challenge for me is to make sure that I can get appropriate health information out to harder to reach communities.
How do you actually engage people who aren't interested in health, and how do you engage those hard to reach groups?
I've been working in health information for about 5 years, and I know there's good information available, but yet as a parent or as a patient, when I interact with GPs or pharmacists or the hospitals, no one hands any information to me, no one tells me where to go, and I usually am the one who's informing them.
I think there are a number of issues about consumer health information at the moment. One of them would be money, and the fact that it's terribly under-resourced and there isn't nearly enough money in there, or money set aside particularly for health information, especially within the NHS.
Awareness of the information that's out there, awareness of the trusted information that is out there from various sites.
We have to make professionals believe that it makes sense for them in terms of what they want to achieve to invest in health information and make sure the consumer understands what they're doing.
As policymakers and leaders, to be able to know which of the plethora of things before us we want particularly to focus upon.
People have to be better at listening to consumers and patients, and that's not just through the traditional focus groups, but actually observing, understanding.
We should allow patients to have more of a say about what they think is high quality information. They should be able to rate the information, and that will help other patients to choose.
And I think all the initiatives supposed to be nationalised, so there's no duplications.
You can do all the questionnaires and surveys under the sun, but I think hearing somebody first hand is the best source of information.
To actually use patients, consumers, to give their opinions or work with them.
Patient organisations themselves can be a key part of brand, and where there's a dominant market leader, as there is in many of the long-term conditions areas, use that brand leader to be the advocate for patient information.
I think it's really important to work with professionals, especially to make them aware of the resources that are available, and to encourage them to disseminate them, and also to give them the trust that they need, that the information is accurate and trustworthy.
So I think the main challenge in overcoming this barrier of people not necessarily being in health that we want to reach is to actually think about it from their terms, what interests them.
The social marketing approach is an excellent way of achieving behaviour change, of which the use of good consumer health information is part of.
The finance director, see it through their eyes. Put yourself in the shoes of the finance director and ask yourself what questions they'd want from you as a sceptical audience to address them. This is worth doing. That's about the business case, particularly around self-management, around reduction in contact time with professionals, around better compliance to medication.
We need to devise an interactive DVD that is aimed at healthcare professionals such as GPs, pharmacists, with a front line and meeting the general public every day. We need to inform them what's the best method of communicating with the general public within the given 5 minutes.
I think PiF needs to be clearer in its messaging, marketing, communications to people about what it actually does.
They are very professional, they're very switched on, they're listening really well. The key difficulty, I suspect, is difficulty of penetration more broadly than people who know it already.
I think these yearly conferences are very important. It allows different organisations and different groups to get together and discuss what information they're providing.
I think we need to do more sharing. We need to find new ways of putting people in contact with one another and encouraging them to share the work that they've already done much better than they do at the moment. And that includes things like their internal resources, their policy documents, their job descriptions, as well as the information and the resources they have about developing information for patients.
It could improve its web presence, its internet presence and social media presence.
I understand they want to lift standards and ensure all people who are providing information provide accurate, reliable, up-to-date information to the patients. But what else are they doing? Are they doing enough to engage the real people in the real public?
Oh,